Hey folks, this is Denny over at TheraThink, and today we're going to talk about transitioning from a group or an agency or a larger organization over to your own practice as a mental health provider, and what you need to make sure you do at the outset so that you're going to have success in your new business venture. We've created a guide that you can go to online at therathink.com and review the step-by-step instructions here, but this video will be a faster outline of that information and a summary of recommendations on how to make sure that the billing and credentialing is done successfully for your practice. So let's begin. Of course, you're going to need licensed mental health providers to start your new practice. You're also going to want to have an office location that you can get mail to reliably and securely so that you can get checks mailed to you, EOB information mailed to you without having to worry that it's going into the wrong hands. You're going to need to establish your own insurance contracts with these different insurance companies if you do want to be paneled and network with them. And depending on if you'd elect to be a group or a solo practice, and how you want to set up your billing, you're going to need to use that tax ID and information, MPI, etc., to establish those new contracts. This is a common misconception that you can just move locations and you're set. Most likely, if not always, you're going to need to establish new relationships with those insurance panels that you want to work with. In your new practice, you're going to need a data management solution of some sort. Some folks do insist on using pen and paper, and that's fine as long as you're organized and you have good records. That's the main thing. A lot of folks enjoy digital solutions, and some want a digital solution plus a billing management component as well. So those are the different things you want to consider, and when making a decision about how you want to store your information. But I would recommend having a backup. I would recommend making sure that you have security and HIPAA compliance in whatever systems you're using, and that you are methodological about recording the things that you do and transactions that you make around your practice. Billing management also has its own challenges. That is why TheraThink we exist, ultimately. So if you do want help with routine billing problems, eligibility benefits, claim submission, tracking, follow-up, correcting claims and appealing rejections, and then of course EOB accounting, where you're able to get a sense of exactly what you've been paid by insurance, what the client owes you, down to the date of service and check number associated with that payment. That is, again, what we do over at TheraThink. Other folks decide to do that themselves in-house or hire an admin to hopefully do that exhaustively. So plenty of options there to consider. You want to figure out a way to manage payment for your clients so that you can charge them appropriately for the services that you're rendering. Again, based on those EOBs that you are figuring out how to get that information one way or another. And you can use a service like Square or Stripe to manage that. And then we recommend QuickBooks Payroll for staff management, submitting W-2s, paying for payroll taxes. You definitely want to handle legal and compliance for your state and city, and make sure that you pay your taxes, that you have a lawyer, you have a CPA ideally to work with. In terms of developing a solo versus group practice, there's a few things to consider here, but I'd say that the largest one is just going to be your preference. You can speak to other practice owners about how to make it make sense for them and for you, but certainly acknowledge that there will be added complexity to establishing a group. We do work with quite a few small groups at TheraThink, and I think that they're great. I think that they make the communication between each other easy. It's easy to find a kind of 4-person unit office space. It's a lot less complex than 8 people or 12 people. So a lot of small practices do quite well because the complexity isn't that high. They can hire out a billing team like TheraThink or have an added admin in-house to help do that. So I'd again recommend folks, especially when they're thinking philosophically about starting a new practice, consider what it's like to be doing it on a daily basis, and if you're willing to and want to be more of a business administrator than a therapist. Might be one way to think about it. And again, it's really up to you and what you need and hope for. In terms of picking a tax ID for your practice, whether you develop a group or if the insurance companies require it, is going to be the most relevant component here. So if you are a solo practice and you aren't working with brands that require an EIN, then go ahead and just use your social security number when filing your claims. But if you do want to establish a group or you want to work with insurance companies that require an EIN, you'll need to establish one. And quickly, to do so, you're going to need to register a business in your local state, then reach out to the federal government's IRS portal to establish an EIN, use that information to get a bank account of some sort so that you can receive income to your business, and you'll want to pay taxes for your business as well. So would also again recommend a CPA to help with that. In terms of credentialing, you want to make sure that you are establishing your own relationship with these insurance companies when you transition to your own practice. And this is a common misconception that you can just move and everything will be okay, but you do most often need to rearrange a new relationship with these insurance companies. And especially if you develop a group where you have a group NPI and a EIN, you'll need to get that information credentialed under a new contract. So make sure to do that. That's a really important step in the success of the billing specifically. And to do that, you want to reach out to the provider relations department at these different insurance companies and exactly say that, and then ask them how to reapply as a solo practice or a group if you've gone through the aforementioned steps of getting a bank account and EIN for your business. So that covers the majority of the things that you'll need to do to transition to your own practice. Certainly, these are things that you will have to do yourself when establishing your own organization, group, or solo of one practice. And make sure to do these to the best of your ability with good record keeping. If you do want help with insurance billing specifically on an ongoing basis, that's certainly something that we do at TheraThink. So consider reaching out to us. You can do so by going to therathink.com/billing-service to connect. And I hope you folks found this to be a useful summary of how to make the smooth transition to your own practice. Thanks.